Welcome to Spotlight on Migraine, hosted by the Association of Migraine Disorders. There are many questions surrounding the potential for increased risk of vascular events like stroke or heart attack for people with migraine. In this episode, Dr. Anders Hougaard breaks down the research on this topic and provides insight on what we know about white matter hyperintensities and migrainous infarction. Hello and welcome to Spotlight on Migraine. I'm your host, Molly O'Brien. Today we're talking about the relationship between migraine and vascular disease. It's a broad topic, so we'll focus mainly on the relationship between migraine with stroke and heart attack. To help us learn more, I'd like to introduce our guest, Dr. Anders Hougaard. Anders is a neurologist, a headache and stroke specialist, and associate professor at Copenhagen University Hospital in Denmark. He has been active in clinical headache research for 15 years, and one of his main areas of research interest is the relationship between migraine and stroke. Dr. Hougaard, thank you so much for joining us today.
My pleasure. Thank you for having me.
Really excited to speak with you about this topic. You've done quite a bit of research in this area, and so we're very thankful to have you. So today we're going to talk about the relationship between migraine and stroke, migraine and heart attack, and hopefully get a lot more information for our followers out there. So before we get started, just to make sure we have that base knowledge, can you describe to us briefly what happens during a heart attack and then what happens during a stroke?
Sure, absolutely, Molly. I think this is a great place to start to really understand the impact of these serious conditions. So if we start with a heart attack, essentially a heart attack occurs when the flow of blood to a part of the heart muscle gets blocked. This is usually caused by a buildup of fat and cholesterol and other substances that form a plaque in the coronary arteries that supply blood to the heart. And if this plaque breaks apart, it can form a clot that blocks the blood flow. And when the heart muscle doesn't get the oxygen and nutrients it needs, it begins to die. And this is what we call a heart attack. And this can feel like intense chest pain, like discomfort, shortness of breath, but these symptoms can vary greatly. And I probably need to point out here that I'm not an expert on heart attacks. I'm a neurologist and I specialize in headache and stroke. So I mainly see people who have headache disorders like migraine, and I also see people with stroke. So if we move on to what a stroke is, so we just talked about heart attack, and a stroke can be thought of as a brain attack. And a stroke happens when the blood supply to part of your brain is interrupted or reduced, and this will prevent brain tissue from getting oxygen and nutrients. And when this happens, the brain cells begin to die within minutes. And we say that roughly 2 million nerve cells die per minute during a stroke. Strokes can be caused by either a blocked artery, this is called an ischemic stroke, and this is somewhat similar to what happens during a heart attack, or it can be caused by the bursting of a blood vessel that causes a bleeding into the brain. And this is known as a hemorrhagic stroke. And symptoms of a stroke might include sudden numbness and weakness, especially on one side of the body, trouble speaking, loss of balance, vision problems. And it's characteristic that these symptoms come along very suddenly, within a split second usually. And a tricky aspect here is that the symptoms of a stroke can, in some cases, be similar to the symptoms some people have during a migraine attack with aura.
We're going to ask you a very broad question, but also complicated and complex question. But I know you're going to help break it down for us. So what do we know about the relationship between migraine and stroke and the relationship between migraine and heart attack?
Yeah, so Molly, this is indeed a complex area, as you mentioned. It's even widely debated within the medical community. So this is actually a field where doctors and researchers currently do not completely agree. And, we need to do more and better research to get clear conclusions on this. So there are studies indicating that individuals with migraine, and specifically those who experience aura, might be at a slightly increased risk of having a stroke or a heart attack compared to those who don't suffer from migraine. Yet, other studies have not found such a strong link. So regarding this relationship between migraine and vascular disease, I would say that there are three important questions here. So one, are people with migraine at a higher risk of having a stroke or a heart attack? Two, can a migraine attack directly damage the brain or even cause a stroke? And three, can the medications that we use to treat migraine increase the risk of having a stroke or a heart attack? So this topic is really complicated, but sure, I'll do my best to explain what we currently know and understand about these relationships based on the latest research. Are people with migraine at a higher risk of having a stroke or a heart attack? I think that's probably the most important one. And regarding that, I would say that the short answer is no, don't worry about it. And the long answer would be don't worry about it, but. So our best insights into this come from studies based on large patient registries. And these studies suggest that individuals diagnosed with migraine, especially those with migraine with aura, are more likely to be diagnosed with a stroke or a heart attack later compared to those without a migraine diagnosis. And I emphasize the diagnosis part here because diagnosing migraine can be quite challenging. For instance, individuals who present in doctor's offices or emergency rooms with neurological disturbances like vision problems, sensory disturbances, and headache might be diagnosed with migraine with aura, even if they actually experienced a transient ischemic attack or a mini stroke, especially if they're young women, I would propose, really. And conversely, during a severe migraine attack with aura, doctors might treat patients for a stroke with interventions like intravenous thrombolysis. And if the symptoms resolve afterwards, as they would do in case of a migraine attack with aura, the diagnosis might be recorded as stroke. And this potential for misdiagnosis can affect the accuracy of studies that examine the relationship between migraine and vascular disease. So that means that having a diagnosis of migraine is not always the same as actually having migraine. Doctors are not perfect. And this is because it really takes experience to diagnose migraine correctly. And the symptoms of migraine with aura, as we talked about, can resemble the symptoms of a transient ischemic attack or a stroke. And plus, you wouldn't expect a relatively young person to get a stroke or transient ischemic attack, but migraine attacks are common in young people. So I would say that not always getting the diagnosis of migraine right could be part of the explanation for this relationship between migraine and vascular disease. But there are other possible mechanisms that have been suggested. One of them is abnormal coagulation. And coagulation refers to the process of blood clotting. Abnormalities in this process can lead to excessive clotting of blood, which increases the risk of forming blood clots, giving rise to strokes and heart attacks. And some studies have suggested that people with migraine have an increased tendency to form blood clots, but there's no definite evidence in this. And another mechanism that has been suggested is known as endothelial dysfunction. The endothelium is a thin layer of cells that line the inside of blood vessels. And when these cells do not function properly, it's called endothelial dysfunction. This condition can lead to problems with blood vessel dilation, and it can contribute to blood clot formation, increase the risk of cardiovascular disease and hypertension and heart attacks and stroke. So there are some suggested mechanisms, but we don't know basically what the reason is.
We don't know. And as with most things that have to do with migraine, it's complicated and we're still learning.
Yeah, so I could say a few words about these large studies that have indicated an increased risk. And again, these are based on large registries. And collectively, these studies show that people who have a diagnosis of migraine are slightly more likely to subsequently be diagnosed with stroke. And this goes for both hemorrhagic stroke and ischemic stroke, so bleedings as well as blood clots in the brain. And they have a high risk of getting a diagnosis of heart attack. And if we look at these studies, if we look at the studies that distinguish between people with migraine with aura and those without aura, it seems that individuals who have migraine without aura are not at an increased risk of stroke. This is very important to know. So no increased risk in people who have migraine without aura. However, those with a migraine with aura diagnosis have a 56% increased risk of having a stroke compared to people without migraine, according to the most recent study summarizing the data on this topic. And it also seems that women younger than 45 years of age are at a higher risk, but there's insufficient data to confirm this currently. So for the relation between migraine and heart attack, there are only a few studies. Most of the studies have been on stroke, but overall, it seems that the diagnosis of migraine increases the risk of having a heart attack by around 25%, but this varies from study to study.
Okay, and those percentages could be a little bit alarming for our listeners. Can you help put some of those numbers into perspective for us? Because I think that will definitely help ease some nerves.
Yeah, certainly, Molly. So when we look at these statistics, it's important to understand what they really mean in everyday terms. In the general population, if we look specifically at women under the age of 45, the annual risk of having a stroke is about 2.5 out of every 100,000 women. And if we consider women of the same age group who suffer from migraine with aura, this risk would increase to about 3.9 out of every 100,000 each year. So while the risk does go up for those with migraine with aura, the overall likelihood of having a stroke still remains quite low. So if you want to visualize it, you could imagine a large stadium filled with 100,000 people. It'd be a huge stadium, actually. All of these people have migraine with aura, and you would only expect to see 1 or 2 more cases of stroke among all those people than you would in a similar crowd without migraine. So it's a small increase when you consider the large numbers that we're talking about here.
That's very helpful to picture that, because when you hear certain percentages, it can be alarming. So thank you for helping us put that into perspective. I want to go back to those kind of 3 questions that you had brought up and dive into those just a little bit, and then we'll talk about a couple other things. One of the questions you brought up was, can a migraine attack directly damage the brain or possibly even cause a stroke? I know when some folks are first getting their migraine diagnosis, it can be alarming, and we think, is this damaging my brain? So what do we know about that?
Yeah, there are 2 aspects to this. One relates to white matter hyperintensities on MRI scans. And I think this is something that migraine patients are generally concerned about and interested in knowing more about. So maybe we should touch upon that.
Sure. Let's do that. Let's talk about, because we have a lot of followers out there who are very curious about what white matter hyperintensities are and what do we need to know about them. So let's look at it in that context.
Sure. So white matter hyperintensities are areas that appear brighter than surrounding tissue when viewed on an MRI scan. And white matter in the brain is responsible for communication between different brain regions, and it contains nerve fibers that are coated in a substance called myelin. This is a fatty substance that insulates the nerves. This helps speed up the signals between these nerve cells. And it appears white. So when you look at it, it appears white instead of the white matter. And white matter hyperintensities are important because they can indicate changes in the brain's white matter. And these changes are generally more common as we age, but they can also be associated with several different conditions. They're often found in people with hypertension, high blood pressure, diabetes, high cholesterol, in smokers. And white matter hyperintensities have been linked to increased risks of stroke and dementia. And the presence of white matter hyperintensities can signify that the brain's white matter has experienced some sort of damage or degeneration. This could be due to reduced blood flow or inflammation, other disruptions of the brain's normal processes, you could say. And although the exact cause of these hyperintensities can vary, the significance lies in what they tell us about the brain's health and function. Before we move on to talking about the relation to migraine, I want to stress that it's important to note that these white matter hyperintensities are something that essentially all people have to some extent. And they increase with aging, with normal aging. And whether you see them and how many of them you see on a scan strongly depends on how sensitive the scanner you use is. So, and how well an MRI scanner is at detecting these especially depends on the strength of the magnetic field of the scanner. So basically an MRI scanner is a strong magnet. And most scanners used in clinical practice have a magnetic field strength of 1.5 Tesla, that's the unit for it. But if you use a scanner with a strength of 3 Tesla, you will see many more of these white matter hyperintensities. So being informed that there are some white matter hyperintensities on your MRI scan is not necessarily a bad or unusual thing. So do people with migraine have more white matter hyperintensities than others? Interestingly, it's widely believed among doctors that this is the case, but I would actually argue that this is probably not true. And if you look at the research into this, there are a lot of small studies comparing MRI scans of migraine patients to scans of healthy people. The problem with these kinds of studies is that the healthy people who participate in them, they're often super healthy. It's difficult to compare them to the average patient. And since all kinds of risk factors, that's hypertension, diabetes, smoking, unhealthy diet, lack of exercise, they will give you more white matter hyperintensities. It's no surprise then that the patients in these studies will turn out to have a higher level of white matter hyperintensities. So for this reason, this needs to be looked at in large studies where people with and without migraine are drawn from the same population. So we need population-based MRI studies really to study this relation. And there have been a few of these kinds of studies published. In fact, there are 6 published studies currently. And in the first couple of studies that came out, no overall difference between people with and without migraine was found overall. But it seemed, based on these studies, that women and those who had migraine with aura were at risk of having more of a certain kind of white matter hyperintensities, at least that is deep white matter hyperintensities located deep in the brain tissue. However, several of the other studies that came along after could not reproduce this, so they basically found no difference in the magnitude of white matter hyperintensities. And one study used a pre-Tesla MRI, a powerful and sensitive scanner, as the only study, and compared only women with migraine with aura to women the same age without migraine, and found absolutely no difference in white matter hyperintensity level between these two groups of people. So there are conflicting results from studies, and we could probably use better studies in this. But my interpretation of this, based on the current data, is that there seems to be no increased white matter hyperintensity load in people with migraine.
That is so helpful to put all of that into perspective. And it seems like it would be way too complicated to factor out what the risk is, because if people have, like you said, there's so many contributing factors to white matter hyperintensities that it seems like we can't just draw one simple conclusion. So thank you for presenting all of that background knowledge along with the strength of the MRI machine, as well as, you know, possibly some troubles with studies. But it's good to know that looking at more current studies that, like you mentioned, women with migraine with aura around the same age as women without migraine with aura have about the same. So that's very relieving to know. And sometimes it can just be we get this news of what research is saying, but we don't necessarily have the background or understanding to break it down, put it into context, and really understand what it means. So thank you for clarifying all that. It's very helpful.
Right.
Absolutely. Can you talk to us about kind of with this understanding of what current research is saying and better understanding how to interpret it, can you tell us what a migrainous infarction is and what people who have migraine with aura should know about that? I have to say, I'm not really quite sure about this subject.
Yeah. So that's sort of the other case where a migraine or a migraine attack potentially could damage your brain.
Okay.
Yeah. So what is a migrainous infarction? This is an extremely rare situation where an attack of migraine with aura turns into a stroke. And this is not only rare, it's even controversial, and it's debated whether this is something that really exists or not. So yeah, so let's talk about some basics about what happens during an attack of migraine with aura. The aura symptoms are caused by a phenomenon in the brain known as cortical spreading depression or cortical spreading depolarization. And even though it's called spreading depression, this has nothing to do with depression in the sense of feeling sad or depressed. The cortical spreading depression, it's a wave of electrical and chemical activity that moves slowly across the cortex of the brain. The cortex is the outermost layer of the brain. So when you're looking at the brain from the outside, you're looking directly at the cortex. And as this slowly moving wave moves along, it triggers a brief burst of nerve cell activity at the front of the wave. And this is followed by a period of reduced activity in the wake of the wave. This reduced brain activity is the reason why it's called spreading depression. So it's a depression of brain activity. And interestingly, the behavior of this wave of high activity and low activity is the reason why if you experience a visual aura, it can have positive features, as we say, at the edge of it, like zigzag patterns or bright dots or colors. This will probably be familiar to some of the viewers. So these positive features can then be followed by a blind spot in the visual field. And so this reflects the spreading and the behavior of this wave in the brain. So you have the positive symptoms first, and then with the negative symptoms. And interestingly, we know a lot about this spreading depression phenomenon. And this spreading depression itself does not damage the brain. in individuals who experience migraine with aura, this CSD, cortical spreading depression, starts spontaneously in nerve cells and goes on and usually stops after about 30 minutes. Now, a very interesting aspect of this is that any type of damage to the brain, to the cortex of the brain, can also trigger cortical spreading depression. I'll just call it this CSD event from now on. So this means that conditions like a stroke, like a bleeding inside the head, a brain tumor, can trigger CSD and produce symptoms that are exactly like a migraine aura. And this means that an episode of symptoms identical to those of the migraine aura could, in rare cases, actually be something else, like a stroke. So if we go back to the migrainous infarctions, these are the rare cases where migraine attacks with aura reportedly develop into a stroke. A possible mechanism for this would be that the blood flow to the brain during the aura becomes so low that it ends up providing too little oxygen and nutrients to the brain tissue, and then it turns into a stroke. But, however, while the blood flow in the brain is reduced during migraine aura, we know this from experiments with brain scans, this reduction of brain blood flow is because the brain activity goes down temporarily due to cortical depression. Okay. But the brain automatically adjusts the blood flow so that there is less activity going on and the blood flow goes down and vice versa. So actually, we would not expect this reduced blood flow to cause a stroke. So we don't have a mechanisms as of how migraine with aura would turn into lack of oxygen in the brain and stroke. In fact, research suggests that these migrainous infarction events are probably not migraine attacks causing stroke, but rather the opposite. A stroke causing the CSD and therefore symptoms that mimic those of the migraine aura. So actually, currently I'm involved in a comprehensive review of all reports of migrainous infarction from the literature, including studies going back to the 19th century and reports in multiple languages. And I'm working with colleagues from Massachusetts General Hospital and Harvard Medical School on this. And my general impression so far, based on these case reports, is that there are no convincing reports of a migraine attack actually turning into a stroke. All evidence, I would say, points to stroke triggering CSD and migraine instead. So so it's important to mention that people with migraine, especially those with aura, it's essential to be aware of this, because if you experience symptoms that are unusual for a migraine pattern, or if they are accompanied by other signs that would suggest a stroke, like weakness on one side of the body, difficulty speaking, if you're not used to having that during your aura, it's critical to seek medical attention immediately. So this could be a sign of something more serious than a migraine. But again, we're talking about extremely rare events.
Okay, that's so helpful to know. And please let us know when all that research is complete so we can report on it. But I like having the inside scoop. You heard it here first. Well, we are winding down on time. I did want to ask you about some other research that you have had published about triptans and the risk of stroke or heart attack with triptan use. We all know that triptans have been around a long time, have been a tried and true treatment. But in your study, what did you learn about the risk of triptan use with migraine and the risk of stroke and heart attack in just the couple minutes we have left?
Oh, yeah. So that's right, Molly. I recently published a study on the relationship between triptan use and stroke and heart attacks, together with my colleagues who are experts in stroke and epidemiology. And I would say basically that this study brings good news for people with migraine, because it confirms what we sort of already knew, that the risk of stroke and heart attacks related to triptan use is extremely small. So let me say a few words about the background. Triptans are vasoconstrictors, which means that they cause blood vessels to contract. And we know from studies that they can contract coronary arteries of the heart and the arteries in the brain, but only to a very small extent. I've been involved in studies looking at the blood vessels of the brain before and after treatment with triptans, and the contraction that we saw here was very small. But this vasoconstrictor ability is the reason why people are concerned that the use of triptans could lead to stroke or heart attacks. If you look at all the studies of triptans in migraine patients and large studies based on registries of patients who have taken triptans compared to people of the same age and sex who have not taken triptan, it really seems that there's only an extremely small risk or no risk at all related to triptan use. Wow. In this study, we speculated that this apparently low risk could be because doctors mainly prescribe triptans to patients who are at a low risk in the first place. So it wouldn't be safe to prescribe it to those who are high risk. So doctors have this tendency to give it to those at low risk. And this could be the reason why it's seemingly it's not associated with an increased risk. So we conducted a study based on health registries here in Denmark, where I'm located. In Denmark, every person has a personal identification number, and if you're admitted to a hospital, they will put your diagnosis and health information into a national registry. And if you fill a prescription for a drug at any pharmacy in Denmark, this information can be found in a national registry as well. So, of course, all of this data is kept confidential, so only doctors who provide care for certain patients have access to their specific information. But with these national registries, we have great possibilities for doing research. So in this study, we looked at all the people in Denmark who filled a first ever prescription of triptan since January 1995.
Oh, wow.
That was around 430,000 people. And we then asked this question, what was the risk of people having a stroke or a heart attack in the 2 weeks immediately after getting the triptan compared to the weeks before? So in this study, people who took triptans, when they were not compared to other people who were potentially healthier or unhealthier because they were compared to themselves, but only before they started on triptans. So out of these 430,000 people, roughly 11 people had a heart attack and 18 people had an ischemic stroke. So you see the overall risk of having a stroke or a heart attack among people who use triptans is very low. And when you compare the period of time after triptan initiation to before, we found that the risk of having a stroke or a heart attack was around 3 times higher after getting the triptan compared to immediately before. So this suggested that the triptan use indeed increases the risk of stroke and heart attack, but not very much. And it's important to note that those who had a stroke or a heart attack in this study, they were generally aged 60 or older. Most of them had had a stroke or a heart attack before, and most had important risk factors like hypertension or diabetes. So in conclusion, it seems that triptans can indeed increase the risk of stroke and heart attack a tiny bit, but only in people who have a high vascular risk. So to the general triptan user, the risk associated with triptan is close to none. So this means that people who have a high risk of stroke or a heart attack should probably avoid triptans. And if you're in doubt whether it's safe for you to use triptans or not, make sure to discuss this with a doctor.
We appreciate you so much, Dr. Hougaard, for joining us today on Spotlight on Migraine. Thanks so much for enlightening us and providing some really important context and insight in the relationship between migraine and stroke and migraine and heart attack. I really appreciate your time.
Most welcome. So I hope now you understand my main point, which is don't worry about it, but.
It's been a pleasure speaking with you. And to all of our followers out there, thank you for watching. I'm Molly O'Brien. We'll see you next time.